Good morning, Peter Goertz. I'm a psychiatrist. Interacting with psychotic patients. I really actually enjoy interacting with psychotic patients. I learn a lot from them. In my opinion, one of the first steps you want to look at when you're about to interact or interacting with psychotic patients is humility. You want to be humble. You want to realize you're not better than the patient. Nobody's better than the patient. And it's a privilege to meet and talk with these people from different walks of life. And also you want to remind yourself, at least in my opinion, anyone with enough stress potentially could become psychotic, including you, me. So to me, that's one important basic step. And it can be tricky. That's another reason for humility, because your diagnostic assessment may not be that easy, and it can be quite difficult to be accurate in your diagnostic assessment. So one example is a patient who seemed on the surface delusional, but it was not all delusional. It turns out she was seemed quite paranoid, and she was saying her neighbor was harassing her at all hours of the night and had even installed a video camera in her apartment. Now, it turns out that her neighbor actually down the road admitted to harassing her and knocking on the door frequently at various times of the day and night. However, the part where she mentioned that the neighbor had installed a video camera in her apartment was not correct. So part of it was delusional, part of it was accurate. So we want to be very careful and not be arrogant as best we can. We want to be kind, respectful. We want to return telephone calls, and you can make it quite brief, but just the fact that you're returning telephone calls can be very helpful in your overall relationship with the patient, and can help, for instance, with the patient being agreeable to taking medicine. Now, you want to realize that your kindness can have, and respect for patients can have, good consequences for yourself also. I mean, you don't want to be calculated in being kind, but for example, if you treat people well with kindness, they may well go out of their way to help you. One example I mentioned is a patient who was a middle-aged gentleman on a psychiatric ward, sitting by himself most of the day, psychotic, responding to internal stimuli, so hearing voices most likely. And one day, another patient, a strong young gentleman, was threatening physically, seemed on the edge of attacking a staff member. And this patient, who was just sitting alone, most likely it seemed hearing voices most of the day, just snapped out of his internal world, got up and came to the help of the staff and actually got into a physical fight, risking his own safety with the other patient. So things really can have quite important consequences, just plain kindness. You want to respect healthy aspects of patients. For example, humor. People can be psychotic, but also have a great sense of humor, of course, and you want to see them as humans. You know, we all have different aspects. And an example of a healthy aspect would be a gentleman I mentioned who was hospitalized on a psychiatric ward, was suicidal, hearing the voice of the devil, as far as I recall, telling him to kill himself. But when he went into the day room and picked up a guitar, the voice just receded. So as much as possible, you want to respect healthy aspects of the patients, encourage healthy aspects of the patients, and that could include encouraging a good diet, encourage playing music, listening to music, socializing, encouraging sleep. So various healthy aspects can be encouraged. You want to always, of course, keep in mind that the patient who is grossly psychotic in front of you may not be inherently psychotic, but it may be, for example, from using methamphetamine or another drug or even a medication. And if someone's delusional, that can be quite challenging. It can really make you feel impatient if every visit they start talking about the landlord or the landlord doing things against them, torturing them. And I'd encourage you to resist the temptation to challenge those delusions. You don't want to agree that what the patient's saying is correct. You don't want to disagree necessarily, and part of what they're saying may well be true. But if you're pressed, you do need to answer, in my opinion, as far as what your thoughts are. So what I tend to do, if someone really presses me and says, "Do you believe what I'm saying, doc?" I would say something maybe like, "From what I'm hearing, it sounds like you may be in your mind taking things to an extreme," and basically at least somewhat normalize what they're going through, because I could go through that also. If I see her smiling at another man, my mind can go to places like that, not that extreme, but I might think, oh, maybe she's cheating on me. Your mind, at least for a moment, can go to these places, not necessarily to a place where you feel like she's leaving the house every night and having sexual interactions with 10 men every night. But again, I think we're all susceptible, and that can keep us, as psychiatrists, I think, in a kind, accepting state of mind. Now, medications can be an issue as far as the patient not agreeing to take them. So that can be a big problem. If patients don't take their medicines, the medicines can't help with psychosis. And the medicines, any antipsychotic, can have potential serious adverse effects. So you want to be upfront with the patients about the adverse effects, about the positive effects, and you want to be especially careful if someone's dangerous. If someone's very paranoid, on edge, that can make them dangerous as far as potentially assaulting someone else, potentially even committing suicide to get away from people they think are after them. So you want to have established trust in an ideal situation, and that can really help with the patient taking medicine. And you'll be surprised, I think. Sometimes people really want to take medicine because they realize that they do better with medicine. So I had a patient who was taking injections of Haldol decanoate, so long-acting injections of Haldol, and at some point asked me, or just told me, "I want the injections more frequently." So we went ahead and arranged for that. And patients can be very cooperative, for example, also with blood work for clozapine, whether it's weekly, monthly. So bottom line with a lot of what I'm saying is your relationship with the patient can really help with the treatment of the patient. Thank you.